Orthopedic surgery gives you the opportunity to improve someone's quality of life, and that was what initially attracted me to orthopedics when I was in medical school. I'm Dr. Angelo DiFelice, an orthopedic surgeon specializing in sports medicine and specifically the treatment of shoulder and knee injuries. Most of the complaints from patients that I see involve the shoulder or the knee. Most of them are due to overuse type injuries where people are trying to get back into shape or they're trying to start a new hobby or a new sport. So a lot of the complaints that we see involve patients who are trying to improve their life and in so doing tend to overdo it a little bit. It's our responsibility to educate the patients to exactly what's going on with them, what options are available to try and help them, and generally speaking, what the outcomes from those interactions are going to be. I try and spend a lot of time to make sure patients understand exactly where we're heading and how we're going to try and improve their situation. Anytime I see a new patient, I treat them as though they're family. I go out of my way to try and make them feel comfortable. We are very dedicated to trying to make sure that all of the needs of our patients will be met. My grandmother would prod me all the time, telling me that I needed to be a doctor. And as time went on and I started interacting with people, I realized that there was a push to try and help people. That was just part of how I was made up. And so that was a natural thing for me to do, and I couldn't imagine doing anything else. I'm married and we have 4 amazing children, all of which are extremely active. They are participating in multiple sports, and we as a family try and participate in most of the things that keep us outside. I've played sports since I was 3 years old. Sports always been part of my life based on my interaction with my brothers. And so I chose to follow that love of sports and make it a career pursuit. I did an extra year of training in Chicago at Northwestern University, where I worked extensively with most of the professional teams in town. From that experience, I was able to learn how to keep an athlete on the field as well as getting the athlete back on the field once he's injured. And I still use those principles today to help the weekend athlete get back to the activities that they enjoy. Anytime someone trusts you enough to want you to help them, it's a very humbling experience. It's also, you feel honored to be involved with someone else's life.